It's Marilyn Ray, and I'm talking now about the second dimension of my theoretical model, which is transcultural caring ethics. So as I mentioned when I first started to share with you about the whole model, we began to talk about the notion of values and beliefs. And so ethics is a part of all of our cultures. We look at notions about right and wrong. We look at, well, from a theoretical, a philosophical sense, we look at the nature of the good. How is something good for the other? How is something good for the society? So this concept, which might seem like kind of a nebulous concept, is very critical for us looking and identifying what is the meaning of the good for the other. And as nurses, when we're relating to the other, and especially when we're relating to people who are from a different culture than ourselves, we are trying to establish that notion of the good. So one of the things that is extremely important in nursing is the commitment that we have to the other so that we can establish trust. And as we know, if there's a dissolution of trust between people, it is very hard, again, to have some level of authenticity when we're communicating with the other. So trust becomes extremely important when we're, as part of our idea of relating to people of different cultures. And then again, within nursing, the fundamental code of ethics, the first foundational element of our code of ethics in nursing is respect for person. So subsequently, respect for the other, no matter how different the other may be from ourselves. We must always respect the other. And so that's significant, especially when we're relating to people of different cultures and we don't completely understand, but we're trying to understand. And then, of course, fidelity, being fair and always devotional to the other. And many of us in nursing have studied different concepts like this. You know, the late Sister Simone Roach, who's written on the human act of caring, definitely talks about this notion of being devoted to the other, fidelity and commitment, and conscience, the idea of actually how we are ethical to begin with as foundational to the meaning of being human. And then other concepts that are coming forward, and especially when we're talking about human rights and truth and justice, the idea of how are we being fair to the other person. And then some of the main concepts in ethics, in nursing ethics and medical ethics, are beneficence, to do good, non-malfeasance, its opposite is to do no harm. And many of you know that that's the central philosophy in medicine, is to do no harm to patients. And it came from Aristotle, you know, who is considered one of the fathers of medicine. And so this idea of doing no harm to the patient. And those of us in the modern era, you know, patient safety is extremely important. And we're trying now to focus on those ideas of potentially harming our patients. And harming can also come from not only maybe not having sterile equipment or washing our hands, but it could be as a result of not communicating carefully and respectfully to the other. So autonomy, especially in American ethics, is individualism. How do we focus on helping the other make the choices that they need, you know, to make for their own health and well-being? And you know, in some cultures, we don't necessarily have autonomy. We might have where family members, communal, there's more community-oriented kind of ethical behaviors that might go on with persons of different cultures. But, and so what we've identified more and more in nursing within the context of ethics, our ethics in nursing, is human rights. And we know that the major people who are a part of our profession are women, and so we're also looking at women's rights. And we know that Mrs. Clinton had said that human rights are women's rights and women's rights are human rights, and I'm a great believer in that concept, that we have to recognize what is a right. And then for myself as a transcultural nurse, I'm interested in cultural rights. What are the rights of persons who come from different cultures? That often we say in our own nation that people have to assimilate, but at the same time we recognize each of us back in history, we are here because we come from some other place, and so we have to look at the meaning of cultural rights. And maybe we can see recently on TV, we're looking at Native rights, or what we call now First Peoples in North America. And what are these First Peoples' rights who have been violated to a large extent over the last 150 years or so. So we're becoming more sensitive to the meaning of cultural rights. And that could be, in Native culture, it could be the right to the land, the right to water, and because we now have issues of pipelines going through different native lands and things of that nature. So we as transcultural nurses, we need to recognize what these cultural rights mean, and they can be, I know in different hospitals here in South Florida, for example, we have people from the Haitian culture, and where they have different use of maybe animals or some things in terms of the healing process. So we have to look at what works, for example, within our hospital cultures, whether or not we can accommodate these various rights, or whether we have to be able to seek ways in which we can share what are the rules, that exist within our institutions. But we have, as nurses, we have to be open to, how do we look at these various cultural rights within the context of our institutional, and there are institutional rights as well, and we have to look at how do we work together within that notion. And then also what is extremely important today is looking at the rights of nature, our environment itself. And as nurses, we are very cognizant of how we're going to protect our environment, and that can be our environment for the patient, when they are in our care in a hospital, for example, and making sure that environment is clean and we are not violating, standards of practice or standards of or issues of potential infection. So infection control, and then if we're in a person's home, when we're caring for them, we are also looking at what is this home environment and how are we being cognizant of protecting the rights of homes or communities. And as we are moving more and more into the community as nurses, how do we begin to look at the interrelationship between nurses as caring, and then looking at ethics, and then these particular rights that are associated with our environment. And so we are cognizant. For example, I have one case study in my book about if we have patients who are from different cultures and they're going into, they're, working the farms, for example, and there might be pesticides in there. So how do we protect our patients? And there might be in an environment that is not healthy for them. So how would we as nurses, for example, speak to persons who are in the corporate world and who are running these particular farms? So it's opening up our minds, to the meaning of ethics, and to do what I call, how do we do good? How do we do the right thing? And so ethics becomes extremely important within this model of transcultural caring, because it deals first and foremost with the patient, but at the same time we're looking at the family, we're looking at certain cultural rights, we're looking at the rights of the human in general, and women's rights, and we're also looking at the rights of nature. So that becomes elemental in terms of what shapes our moral knowledge, our moral caring, so that we can in fact be cognizant of how we can be more caring by understanding these particular ethical principles. And as I mentioned earlier, we do have a code of ethics by the American Nurses Association. Each member state of the International Council of Nurses has a code of ethics. So each of us has to be responsive to these codes of ethics in terms of the way in which we care for our patients. And so that is my second dimension, and it becomes extremely important when we are engaged in transcultural caring and transcultural nursing.